Chapter 5: Clinical and Support Services and Program Management. Clinical and support services include voluntary HIV testing and counseling, antiretroviral therapy, and treatment of sexually transmitted infections and co-infections, such as tuberculosis and viral hepatitis. They also include additional services, such as services for sexual and reproductive health, harm reduction for sex workers who inject drugs, post-rape care, and mental health counseling. The key principles of designing and delivering services to sex workers are voluntary and informed consent, confidentiality, and providing appropriate and accessible services that are also acceptable and affordable. Partnerships with doctors and nurses and the capacity building of medical personnel is crucial. Medical workers don't want to purposely humiliate sex workers. Like many others, they may have limited knowledge about sex work and could be affected by societal stereotypes. Sex worker-led organizations and community leaders play an important role in training medical personnel, and SWIT is a good tool for that. It is not possible to reach all medical personnel, but it is realistic to train and maintain relationships with those doctors who already provide medical services to sex workers. Accessibility of clinical services is linked with the work of community-led services, as seen in Chapter 3 of SWIT. The choices of sex workers should be respected. Some sex workers may want to be accompanied to clinical services, while others may not. In some cases, it is necessary to accompany a sex worker to the doctor and make sure that the quality of services is appropriate. Some doctors may use too much medical terminology, for example. Be ready to answer the sex worker's questions if it is not clear what a doctor says. You may ask the doctor to explain once more in plain language. Treat sex workers' feedback carefully and address problems with doctors without delay. Communicate with the medical facility management to flag and change any undesirable practices towards sex workers. Access to services should be ensured for all persons, regardless of lack of ID or residence registration. We may not expect changes to happen fast, but our efforts do lay the groundwork to improve the access and quality of services in the long run.